Hello from London. This is a Facebook Live all about acne. I am BBC Newsbeat's Ben Mundy, and with me we have YouTuber Katie Snooks.
Hello.
And Dr Ayesha Sharieff. Now, we've got questions coming for Dr Ayesha in a moment, all about acne. Get in touch, leave the comments below, put a name there, say hello, and we'll go through some of those in a moment. First, I want to talk to Katie, because you've been on a bit of a journey. We're doing this because BBC Newsbeat has a brand new documentary out today. It's called Me, My Spots and I. It's behind me, somewhere there. There you go, you can see it. It's available on the BBC iPlayer right now. We'll talk about that in a moment, but first, Katie, let's talk about your journey with acne and dealing with kind of spots for a long period of time.
Yeah, so I have had acne for 10 years now. It's been a really long kind of emotional journey of learning to feel good in myself with acne and learning ways in which I can deal with it and help cure it. So I got it when I was 18, 10 years ago, and went to the doctors so many times, went to my GP so many times, tried so many antibiotics and topical treatments. Some of them worked for a while, and then the acne came back, sometimes even worse, or they would just give me quite uncomfortable side effects, which meant that I was just constantly always on a journey to try and get clear skin, and it was heartbreaking as a child, like as a teenager, trying to find my way and be confident and learn to be a young adult.
That's the thing, isn't it? Because it come at a time where, at the worst possible time.
Yeah, like, so when I was at uni especially, my acne was so bad, and all my friends were going out partying and just having a great social life, and I was just in bed and like, oh, I don't want to go out, I don't want to put makeup on, I literally don't feel good about myself.
But your skin looks amazing now. So tell us all about that. So you found a solution in the end? Yes,
so after a while, my doctor referred me to a dermatologist who then put me on a medicine called isotretinoin, which is more commonly known as Roaccutane.
Well done.
Yeah, I pronounced it right.
Yeah, excellent.
So yeah, I was on it for 8 months. Lots of side effects. It took a while to kick in, but now I've been off it for a month and a half, and I could not be happier. I feel
That's awesome.
Yeah, I finally feel like I'm myself again, and I'm confident and I'm happy, and I just want everyone else to feel that way in themselves.
Cool. Yeah. Okay. So this is a Facebook Live from BBC Newsbeat. We are talking acne. If you have any questions, maybe you are suffering with acne right now, maybe you have suffered with it and you have some advice for others that are watching this Facebook Live, leave your name and say hello and put a comment below. We'll go through some of those in a moment, and we'll get your questions on acne to Dr Ayesha in a moment. Katie, let's talk about the documentary then. Me, My Spots and I. It's available on the BBC iPlayer, and you've been involved from the start. Tell us all about it.
Oh, it feels like my baby. I'm really I'm really proud of it. So it's a documentary where I've travelled around the UK meeting people who have suffered with acne, who have tried the kind of medication that I've tried, and either it hasn't worked or it has and they're on it forever. I've just met some incredible people, and I've spoken to them about how they ultimately feel good in themselves.
Should we talk about some of the people you have met?
Yes. So first we met, went to Edinburgh to meet Libby, who was amazing. She's 22.
Yep.
And we went on a night out with her and her friends, and kind of just got to know her, like how her acne affects her everyday life. And she's training to be a beauty therapist. And she finds it really difficult. She's actually been on Roaccutane 3 times now, and it hasn't worked. And she's paying her own money on this new light therapy treatment. And that's kind of worrying that she's having to go to that extreme of paying a lot of her own personal money to find a cure for her acne. Something
we'll talk about with Ayesha in a moment. And then who else have you met?
I met Jessica, who is a lovely girl. I actually went trampolining with her and her boyfriend, which was
For the documentary.
Yeah, not just for third wheeling your date. I did third wheel their date. So I just got to know them both and found out in the ways in which Brendan, her boyfriend, supports her with her skin and how it affects her life. And then I also went and met a woman called Sarah and her son George, who's 15, they are both on Roaccutane. Sarah's actually going to be on the medication for the rest of her life. Her skin was very cystic and painful, and George has inherited that.
Sarah's really interesting. So she is 43 and she still has acne, or is dealing with acne. The medical term, I think I'm right, adult acne is for over 25. So I think people hear people talking about spots and acne and automatically assume it's your teenage years, you'll grow out of it. But what we've found doing this documentary and looking into this with research is that adults suffer with acne as well. So it feels like a good time to bring you in, Dr Ayesha. Don't forget, if you've got any comments, any questions, put them in the comments below and we'll get through some of those in just a moment. So it's not just teenagers, is it? No, absolutely not. At any age, really. We have women in their 30s, 40s, men and women in their 30s and 40s, and they are, like you said, asking the question, look, I thought my teenage years were way behind me, terrible skin. So, you know, that message has to get, it's not normal for anyone, although it's very common, and there are treatments that we should be trying to get people to. It feels like a good time to ask, what is acne? So acne is a inflammation of your sebaceous glands in your skin, and it leads to, sometimes you have blackheads, whiteheads, but then as you move to the more serious end of acne, you will have cysts. Some of them will be very painful, some of them will be full of possibly yellow pus. Sometimes you get scarring as those heal, and that leaves sometimes, especially in mixed race skin, in Asian skin, you get hyperpigmentation, so you can get a lot of dark marks, a lot of redness in the skin as well, which can be, you know, disfiguring. Okay, we've got a question from Jonathan Pyle. Hi, Jonathan. Thanks for checking us out. Dr Ayesha, what causes acne? Is there one single cause? Absolutely. I suspect not. Good question. Well done, Jonathan. I would say there is, unfortunately, to now, we do not have an absolute one cause. Okay. There are lots of myths out there. So, you know, people say, oh, you're eating too much greasy food, you know, you're having too much chocolate, you're overweight. In the vast majority of cases, unfortunately, there is no known origin for your acne. So on that, with diet, does it affect it? So if you are eating fatty foods, does that lead to acne? Could it lead to acne? As your doctor, I'm always going to tell you to stay healthy, you know, get on the right path with that. But sadly, no matter how clean you eat, how much you exercise, sometimes you will have terrible skin. Shall we bust some other myths? What about putting toothpaste on your spots? Everyone does that, right? Do you know, I think it's harmless if it works for you, but it's not a medical treatment. It's not going to really have much effect, especially if you have that more severe acne, nodulocystic acne. Okay. Yeah. Any other myths that you would like to bust for us? I think, wearing makeup. So, you know, lots of girls particularly get told, oh, you wear too much slap on your face, that's why you're suffering, you need to take it off. As I think you said earlier, you touch your face too much. Yeah. You've got spots because you don't wash your face. Absolutely. So, in fact, overwashing your face can aggravate your acne, can spread it around the face. So, yeah, that's a myth. Okay, another question. Shelley Williams says, I've recently been diagnosed with, is that perioral dermatitis, yeah. Excellent. That's why we've got a doctor here. I know we're told to put nothing on it, but my skin is so tight and dry. Is there anything I can use? Okay, so hi, Shelley, and nice to hear from you. That is quite a rare form of dermatitis. Ideally, you would avoid steroids because steroids can flare up the infection and make more sort of pus-filled lesions appear. I think the best advice is to continue seeing your GP to get treatment for that, but try to avoid aggravating it with any strong creams of any kind. Let's look at those treatments then, because Katie's mentioned isotretinoin or Roaccutane, as you might know it. There are various steps before you get to needing Roaccutane. So, Katie, what was your journey visiting the GP? What were you offered to begin with? So many different antibiotics. Minocycline, I was on that a couple of times. Doxycycline, tetracycline, that one. Yeah, oxytetracycline. Oh, that one as well. Yeah. I've done them all, and then loads of topical treatments as well, which I found dried my skin out a lot, made my skin quite red, quite sore.
Okay, so look, at this point, I want to say everyone is different, and I have lots and lots of patients who've been successfully treated with a few months of antibiotics. So I wouldn't knock antibiotics completely.
Yeah, no.
There is a role for all of these different treatments. Some people may just need a little lotion that the GP can prescribe just to remove the sebum from the pores, the oil that's blocking the pores, and that's enough to clear them up. I've got lots of girls and boys on Duac, which is a dual action. There's lots of other variations of that. So it's got something that strips out the pores, and it's also got something to help repair the skin. So I think we always start at the first rung of it, which is a topical, which is a lotion or a cream or a gel, and then we move up to the antibiotics. If you're a girl and you have very hormonal looking acne, you know, it's getting worse around the time of the period, we often advise the contraceptive pill, which can be useful for that.
What's the time frame of leaving someone on one particular medication? Like, how quickly should it be cleared up before you then consider other options?
Definitely. I say, look, acne is not going to go. If you go to your GP, we're not going to get rid of it in 24 hours. It's going to take maybe 6 weeks to start to see those improvements. So I would usually say, look, come back and see me 6 to 8 weeks and we'll review. And honestly, if it's not working, tell us, we will help you. We will try to get you to the treatment you need.
Thank you. This is a BBC Newsbeat Facebook Live. I'm Ben Mundy. Hello. This is Katie Snooks, a YouTuber, and Dr Ayesha. We're taking your questions on acne, whether you have acne right now or you've had acne in the past. Get in touch on the comments below and we'll go through some of those in a moment. We are talking to you today because BBC Newsbeat has its brand new documentary out. It's called Me, My Spots and I. If we move out of the way, there it is. It's on the BBC iPlayer right now. Go and check it out. It is presented by Katie here because, Katie, you've been on this acne journey. You've kind of used the treatments. You've now cleared your skin. Just go back to when acne was at its worst for you. How low did it make you, and kind of what things did it stop you doing, if anything at all?
Now my skin is good. I look back at that time and just see a young girl who was just at a loss. I kind of felt like I was very alone. I felt like I was the only one burdened with bad skin, and all my friends had great skin, and very jealous, didn't want to go out. It got to a point where I'd been invited out and I was just like, I can't do this. I don't feel good in myself. I will bring everyone's mood down because I'm feeling so rubbish about myself.
Did any of your friends or family detect that?
I think my close friends and family always been very supportive. Always, my parents have acne and they still get spots now. So I kind of have been brought up around very positive, inspiring people. But it's people that you don't know. And
if your parents are watching, I want to say good job, well done.
Hi, Mr. and Mrs. Snooks.
Hey,
hello. Right, a couple more questions. Laura Neal, hi Laura. She says, I keep being given steroid creams and now I'm on antibiotics, but no change yet. Any suggestions what I can do that might be better? I guess it comes down to how long Laura has been on those antibiotics for.
I say if you've given it a good bash, you've been on it 2 or 3 months, definitely go back. Think about whether you're safe to go on the contraceptive pill, because there are pills that can really reduce the amount of spots you're getting. But if it is severe acne, if it's painful, maybe go and see a dermatologist. Get that GP to refer you on to a skin specialist.
We'll come to referring and getting to see a dermatologist in a moment. Quick one, Charlotte Greensmith. Hi, Charlotte. I'm about to finish Accutane or Roaccutane. I think Accutane is what the Americans call it.
That's right. Yeah.
What are the long-term effects that I should look out for on this particular drug?
I think
there are a lot, aren't there?
There are a lot of side effects when you're on the drug, but as you come off the drug, hopefully those will start to go down and your risks go right back down to normal, I think, after a year. So I think I wouldn't worry about... as you've heard, lots of people have been on it 2-3 times. If you're under the supervision of a dermatologist, they will explain what the consequences are, but generally it's quite safe afterwards.
OK, let's talk about the journey that one might go on. So you go to your GP, you're unhappy with your skin, you go to the GP, you might visit them a couple of times, 3 times. If it's not cleared up, that's when you should be asking or looking to go and see a dermatologist.
Look, even on the first time, if I see that your skin is really painful, it's really severe, I'm not going to waste time. I'm going to get you to see a dermatologist. But you may have a wait to see that dermatologist. So in the meantime, we'll get cracking with, the antibiotics, the topical things that we can do. Once you get to see the dermatologist, I think you can explain what you had to do to get on Roaccutane, but we need to do a little bit of workup first. We usually do some blood tests.
Yeah.
And we also, for girls particularly, it's very, very important that we discuss contraception.
Yeah. So I was actually told that you can't have Roaccutane for a girl unless you are on 2 different types of contraception. Yeah.
The reason for this is Roaccutane has serious consequences if you fall pregnant for the fetus, and we will advise a medical termination because of the severe abnormalities it's likely to create in a fetus that develops. So that's why we have to be really strict about trying to encourage people to go on contraception, even if you're not sexually active. We do say it's just safer because sometimes these things are unplanned.
Which is why it's so important to speak to your GP and speak to the dermatologist. We've got a few more questions coming in. If you have anything to ask Katie, who's been on this journey for BBC Newsbeat and making a documentary about acne, then leave a comment below. If you've got a question about your acne or have suffered acne, Dr Ayesha is your lady. Right, here we go. Hannah, hi Hannah. I have Darius disease and eczema, and I've had mild acne on and off for years. Every so often I get my pores cleared out and this helps, but within a few months it gets bad again. I feel like I'm fighting a never-ending battle. I've tried GP medication, but now they won't give me any as it's not bad enough, she's put in quotes.
Okay, listen, I'm really sorry, first of all, that you're having all these problems. And I'm sad to hear that your GP has said, look, we won't prescribe it because it's not bad enough. I think if it feels bad, definitely find maybe a different GP. In the same surgery, often you'll have different GPs. And sometimes it's good to try a different GP because they may have a different approach or a different treatment.
Let me just, because we've heard that a few times in the research to this. How easy is that? We all go to the doctors and sometimes don't get the answer that we are looking for, but it feels wrong maybe to kind of ask, honestly, go back out to reception and say, I want to see someone else.
No. Honestly, I will not. Personally, and I think I can speak for most of my colleagues, we won't feel offence. If you want a second opinion, if you feel that maybe there is something that you haven't quite reached, don't be afraid. Go and book another appointment with a different GP.
Okay.
Yeah.
Good advice. Any questions for us? Comments below. Kaylee's got in touch. Hi, Kayle. I have acne scars around my mouth and I feel my skin has lost kind of elasticity. That's not right. Around this area. I noticed this in photos of myself. Is there anything that could help? Let's talk about scars, because it's not just suffering with acne when it's there. It's then dealing with the aftermath, the scars that it
definitely
leave.
Okay, so scarring, particularly after you've just finished your treatment, it can look awful, but the good news is most scars with time will lighten up and fade. There are some people who've had severe acne that their scars aren't going to fade. And for those people, sadly on the NHS there isn't an awful lot of cosmetic treatment available, but there are qualified skin specialists who can see you about the scarring to maybe suggest things. There are things like laser treatment, chemical peels that people do, but I need to say, please do not go to see anyone who isn't a qualified dermatologist for those kind of treatments, because there's lots of people out in the market now who are sort of setting up shop, as a skin specialist, and they're not actually a dermatologist. Look and see if they have the qualifications, if they're part of BAD, the British Association of Dermatologists, because you need to use caution with these kind of treatments.
You need to do your research on something like this. You mentioned kind of laser treatments and stuff and things outside of the NHS.
Yes.
Katie, you mentioned that you'd been to meet Libby in Edinburgh for the part of the documentary.
Yes.
So let's just recap a bit about your meeting with Libby, and then we'll ask Dr Ayesha a bit about that.
So Libby is training to be a beauty therapist at the moment, and she has bad skin, and she's tried Roaccutane 3 times and it hasn't worked for her. Now she's got to a stage where she's having to pay for private treatment with her own money, and it's a kind of like light therapy treatment, and she's kind of pinning all of her hopes on
And
this.
is it working for her?
I think she said she's seen a little bit of a difference. She's had like 2 or 3 sessions, so she's got a while to go yet, but I think at the moment she's feeling quite positive about it.
Okay. I mean, it is sad when young people feel that when they feel that the door's been closed and they have to go off to the private world, but sadly the NHS hasn't got all the treatments sometimes that private doctors do have. Or we tend to practice what we call evidence-based medicine. So if there's good evidence that a treatment will work, then we usually put it into practice. But I think some of these newer treatments, the evidence isn't there that they're effective, and that's why we haven't commissioned those. But I mean, hopefully moving forward, and hopefully with programs like this, we can promote the idea that, you know, this is a very important issue that we need to treat and we need to fund.
Yeah.
Talking of programmes like this, this is a BBC Newsbeat Facebook Live on acne. We have our brand new documentary available on the BBC iPlayer. It's called Me, My Spots and I. And I must draw your attention, 12:45 today, BBC Radio 1, BBC Radio 1 Extra. We are dedicating the whole 15 minutes of the Newsbeat programme to acne, so worth listening to that. So it's BBC Radio 1 and BBC Radio 1 Extra at 12:45. Right, we have some more questions coming in, I think. A technical problem. Hang on, there we go. Sean says, does aloe vera work?
I think if it works for you, it works. I wouldn't say that that's a treatment that your GP is going to give you, but if you find it helpful for you, by all means, go ahead. That's
because there are treatments available in supermarkets on the high street.
Definitely.
Should you try all of those first before you go and see your GP?
I would say you can do both. It's not a one or other. If you feel that those over-the-counter treatments are helpful, go ahead and keep using them. There's no harm in aloe vera. It's quite a safe little thing to use. Products that contain benzoyl peroxide tend to be products that can help really deep cleanse the skin. There are facial scrubs as well that people find really useful.
But benzoyl peroxide, is that what can dry the skin?
Yeah.
Yes. So sometimes what I say is if you're using it every single day and you're getting very dry, sore skin, maybe use it alternate days, switch it up.
Can it be like the more expensive it is, the better it is?
Absolutely not. Honestly,
so
absolutely.
Don't go on price.
No, definitely don't. I mean, on the way here, I met someone on the tube, and they were saying they went to a particular high-end boutique to get some treatment. And I'm glad if it works, and if that was money well spent. But I would say there are simple things that you can do. You don't need to spend a lot of money.
So just give those things that we should be looking out for in supermarkets and on the high street. So benzoyl peroxide.
Yeah, benzoyl peroxide. I think sometimes products with salicylic acid in them, they help to remove sort of the scarring as well. And facial scrubs. I think there is no one answer. Everyone has a different skin type and different things work for different people. If your acne is disfiguring or if it's painful, you really need to be seeing your GP because they won't work. There's no evidence these products are really that effective.
Okay. James Harris. Hi, James. Thanks for getting in touch. I suffer from eczema and I have been prescribed different creams and tablets, but my skin still flares up and won't stop itching. Can you please tell me what to do? I think that's maybe more eczema, but let's quickly get an answer for James. Thanks, James.
Yeah, unfortunately, like acne, eczema is another condition where there's actually no absolute cure, and I think it's a continual battle to keep it under control. So definitely using good moisturisers. We call them emollients, things that lock in the moisture. So there's lots of products out there. Maybe see your GP to get the right one, and keep up the battle. Do not stop the creaming with eczema, definitely very important.
Okay, thank you. This is a Facebook Live from BBC Newsbeat. We're talking all things acne. If you've got a question, drop it in the comments below and we'll get to it in just a moment. Kate, I just want to ask you, when you were suffering with it, what did your friends do that really helped? What, you know, if someone's watching this now and their friend has acne at college or school, what can they do to kind of offer support and help?
It's a tricky one, isn't it? Because you don't want to go up to someone and say, "Oh, your skin looks bad today," or what, like, "Here's some of my makeup, go put it on," because that can be a little bit painful. But just making them sure that they're not, like, making them aware that they're not alone. Other people do suffer with acne. Sharing stories as well, I always find is really reassuring. Like, "Oh, I've had acne before. This is things I did to make myself feel better." Yeah. Just making them know that you're there for them and their skin doesn't determine what kind of a person that they are.
Yeah.
So one of the reasons that you're presenting this documentary for Newsbeat is because you're a YouTuber, you've vlogged about your journey on Roaccutane. So for 8 months of your life over last year and some of this year, you put yourself out there for everyone to see without makeup. There's lots of tears at times as well watching some of your vlogs. So how big a decision was that to put yourself out there and kind of show everyone your journey?
I feel right now that social media has such an impact on people's lives. Everyone looks very perfect, the whole kind of Instagram culture, and I kind of wanted to just tell people that life isn't perfect. People have spots. I'm a YouTuber. I put myself out there daily looking good, but in reality, this is what's underneath. So when I was filming these videos, I kind of I didn't think anyone would watch them, but in reality, when they started getting views, I was overwhelmed by the amount of people that could relate to it, and it just made me even more passionate to spread the word that people do have acne. There are things that you can do to make yourself feel better, and there are treatments out there available too.
That moment that you kind of clicked upload to the first one, what was that
I wasn't
like?
even going to upload that video.
Okay.
That's a scary thing. I filmed it. I spent a whole month filming a video about my skin every single day, and it got terrible in the first month of being on medication, and I was like, no one's going to watch this. It's just me crying about my skin in my bedroom. But I'm so glad I did.
That's one of the things that I guess has come from the documentary. People that we have met doing this have said, oh, I feel so alone, it's me.
Yeah.
But it's not, is it? But every single person we've met feels that acne makes them feel like that.
I mean, I'm going to put this stat out there. 85% of people will have acne at some point in their lives. I mean, that's the majority of human beings will have acne.
Or who will know someone that has suffered
And
with
of
it.
those 85%, there are a few people who will have the severe acne, which is what you're describing. So it's not uncommon. I think if you all think about school, you can think of someone in the class who you saw, with that kind of severe acne.
This is a BBC Newsbeat Facebook Live. I'm Ben Mundy. This is Katie Snooks, a YouTuber who has presented a brand new documentary for Newsbeat. It's called Me, My Spots and I, and it's on the BBC iPlayer right now. This is Dr Ayesha Sharieff. Any questions, drop them in the comments below and we'll go through some of them. Ayesha, I think it's been quite telling that even on the journey for the documentary, very few males come forward, lads came forward. And lots of the interaction people getting in touch at the moment seem to be female. Is there a difference? Are boys more likely to suck it up and not go and see their GP?
100%. I think there's still this feeling that I'm a man, I don't need to complain about my skin. That's kind of quite a feminising thing to do. But I do have male patients, but I would say definitely it's more female centred. And we need to bust that out of there, that if you're a guy, open up, talk about it. If it's making you feel bad, if you're getting teased about it, if it's affecting, I have some patients who even don't go to college because they've got a really bad skin day and they don't want the flack that they're going to get from their mates. So I think it's really important to let's just get rid of this, that it's a male-female thing.
We met.
Say, one of the boys that features in the documentary Me, My Spots and I is a guy called George who took time off school because of his acne. Do you want to tell us a little bit about him, Katie?
Super inspiring 15-year-old who has had acne. His mum had acne, so he's kind of got it passed down through genetics, and he wears makeup to cover his blemishes. He's on Roaccutane, and I kind of feel like more people should be as open as he was about talking about how it makes him feel and the makeup he wears and the things he does to make himself feel better about acne. You need to watch the documentary.
I was just about to say, if there is one person you look out for in the documentary, it's George. It's called Me, My Spots and I. It's on the BBC iPlayer right now, but very, very inspiring. We've heard stories of people that go and see their GP about an arm complaint or something wrong with their leg, and in the last few seconds, they go, oh, have you got anything for my skin?
That is what we're trying to do. We're looking for the hidden agenda. Everyone generally has a hidden agenda when they come to the doctors, and a skilled doctor is going to look out for it. A lot of people won't mention it, but I might see it. So I might just in passing say, would you mind if I just, made that comment? And then it's the relief is there. But stories like this are really encouraging, I think.
Here's a good question. How quickly can I get rid of acne? Because there must be people that come and see you as a GP. I've got spots. I want them gone. What is the timescale?
Again, I'm sorry to say this, but it's individual to individual. Some people within a week or two, their skin is getting better, and some people it is a good sort of 2 months on the treatment before they start to see improvements.
Yeah, I feel like my skin got a lot worse before it got better on Roaccutane, I think it took about 5 months to start seeing real difference. But after that, it was just day by day.
Yeah.
On that treatment, kind of when you didn't see an improvement. When you started it, did you expect an improvement straight away?
No, I did I'm very funny like that. I do a lot of research. So I knew I wasn't going to see a difference for a couple of months, but it's so disheartening, I think, to have so many side effects on the medication and not see an improvement, but you've just got to stick with it. I think that's one of my biggest tips. If you're on acne medication, whether it be antibiotics or something a bit stronger, you have to do the whole course, otherwise it isn't going to work for your skin and it will come back.
Yeah.
Okay, we are running out of time very, very quickly. A final thought from you, Dr Ayesha, on acne and anyone that is watching this right now and suffering with it?
I'd say if you are feeling low, if you're feeling down, do not hold those feelings in. Please tell someone. If it's not a doctor, if it's not a nurse, tell someone you're close to and get the strength to make an appointment. Come and see the doctor because we want to help you.
And there is lots more advice via the BBC Advice pages. We'll post a link below in just a moment in the comments section, but lots of material on this at Newsbeat online today. Katie, one last final thought about it all?
Hang in there if you've got acne. It will get better. It will get to a point where people won't judge you as much. And watch this documentary because you might learn some tips.
Yes, the documentary is called Me, My Spots and I, and it is on the BBC iPlayer right now. And BBC Radio 1 and BBC Radio 1 Extra at 12:45. So within the next 40 minutes, we'll have a whole programme, 15-minute programme on acne. It's BBC Radio 1 and BBC Radio 1 Extra on Newsbeat. Thank you for watching this Facebook Live from Newsbeat.